Panic disorder, a presentation by Shannon and Kelsea A7.
A panic disorder is a type of anxiety disorder. With panic disorders, a person has repeated attacks of intense fear that something bad will occur unexpectedly. It involves episodes of extreme anxiety called panic attacks. These panic attacks typically last about 10 minutes, but can be shorter or longer. Some panic attacks require medical intervention.
Symptoms of panic disorders are wide-ranging and include rapid heartbeat, perspiration, dizziness, dyspnea or shortness of breath, a choking sensation, chest pain, nausea, numbness or tingling, chills or hot flashes, faintness, a sense of altered reality, trembling, and uncontrollable fear such as the fear of losing control and going crazy, and the fear of dying, hyperventilation, and thoughts of impending doom. This is a video on panic disorders in children.
Hello and welcome to this special interview on panic disorder in children, sponsored by the Anxiety Disorders Association of British Columbia. I'm Dr. Michael Catchpole and my guest is Dr. John Walker. Dr. Walker is a clinical psychologist and director of the Anxiety Disorder Program at St. Boniface Hospital. Dr. Walker, thanks for being here.
Thanks for having me.
Dr. Walker, let's talk a little bit about some of the signs and symptoms of panic disorder in children. Many adults looking at this video might have had a panic attack themselves. How is panic disorder expressed in kids?
Common problems that children have are stomach aches, feeling of nausea, dizziness, tight chest, chest pain, and children may mainly focus on one symptom. They may mainly focus on the nausea, for example.
Okay. Now, again, in adults, it's sort of more specific and often that, shotgun in the face kind of feeling. Is it that dramatic for kids as well?
It varies quite a bit between children. Some children may be focused mainly on two symptoms. Other children may have that feeling like you're just about to be in a car accident. You have an adrenaline rush.
Okay. Now, what can we do? What's probably the most important strategy that one should take as a parent or caregiver?
I think the most important strategy for parents is listening and accepting your child's feelings and experiences. So asking your child how they feel in their body when they're feeling upset and asking them what their worries might be. And you might have to ask the child whether they're worried about something very bad happening.
Well, that's interesting because I think a lot of parents sort of try to block a child's feelings. They think the right thing to do is say, oh, well, dear, this will get better. But you're saying the opposite. You're saying really validate what they're feeling?
Yeah, it's very important to listen and accept your child because part of what will help them is for them to accept how they feel and go on with their activities anyway.
All right. Other things that are important in dealing with panic disorder in children?
One of the key things after the validation is keeping up with normal activities and keeping up normal routines, especially things like going to school, going to sports activities, and really living your life in spite of some anxiety.
So in other words, avoiding anxiety reinforces it?
Absolutely. The most serious impact of anxiety problems if someone starts avoiding their normal routine. That has a negative effect on their lifestyle.
Or if a parent encourages them to do that, I guess the parent's trying to protect the child, but in fact they're unintentionally reinforcing the anxiety?
So accepting the anxiety but giving the child the message is important to keep up with life's routines anyway, and if they keep up with routines, actually they'll feel much better at the end.
Very interesting. And would that include, rewards or sort of positive feedback for them mastering things that are hard for them?
So when a child faces a difficult situation where they're afraid they might have this bad feeling like dizziness or stomach problems, if you celebrate afterwards by going out for a little snack together, use a lot of praise, that's very helpful.
Very interesting. What about breathing techniques or ways that some adults use to calm themselves?
Very often if a child is very worked up, you can even watch their breathing a little bit to see if they're breathing fast. And if you feel they're feeling really worked up and they're telling you that, just teaching them to breathe slowly and regularly, breathe through their nose, can really help themselves to calm themselves when they're really feeling worked up.
What about self-talk? Are there things a child can be saying to themselves when they're beginning to become panicky?
When a child is feeling anxious or not wanting to go to a certain place, like not wanting to go to school, just teaching them that they can talk themselves through it by saying things like, my stomach feels really upset, but I know I'll be okay. If I have to take a break, I can go to the office for a few minutes and then go back into class. Those kinds of strategies really help the children to cope.
So in other words, don't avoid anxiety. Anxiety is unpleasant, but don't avoid it.
That's a key point, really, that all of us will experience anxiety in our life, and all of us will experience some stressful circumstances. But if we keep up with our normal routines, if we keep up with our social life, we'll get through it very well.
Excellent. Dr. Walker, thank you so much. Very, very interesting, and we appreciate your help. Hope you enjoyed that interview with Dr. John Walker, clinical psychologist from St. Boniface Hospital.
There is no single cause of panic disorder, but inheritance plays a strong role. Other factors that can contribute to development of a panic disorder include psychological factors, stressful life events, life transitions, the environment, and the mindset of the person. Some normal bodily reactions can be exaggerated by the thinking of the person, which can result in development of a panic disorder. The first panic attacks are generally triggered by physical illnesses, stressors, or certain medications. Another significant cause can be chemical imbalances in the limbic system, especially with the regulatory chemical GABA-A. The reduced production of GABA-A sends false information to the amygdala, which regulates the body's fight-or-flight response. These actions produce the physiological symptoms that lead to the disorder.
The earliest report of the disorder was in the 17th century in The Anatomy of Melancholy by Robert Burton. The first medical documentation of panic disorder was by Civil War physician Jacob da Costa. He described symptoms similar to panic disorder in his writings. Freud is widely considered the first psychiatrist to study the disorder in depth. However, he coined the term anxiety neurosis to describe the disorder. A few famous people that have had panic disorder include Princess Diana, Johnny Depp, Courtney Love, Michael Jackson, Marie Osmond, Donny Osmond, Cher, and Abraham Lincoln.
There are a few different methods of treatment for panic disorders. The first is cognitive behavioral therapy. This is a talking therapy that aims to solve problems concerning dysfunctional emotions, behaviors, and cognitions through a goal-oriented, systematic procedure.
A second is psychodynamic psychotherapy. This is a form of depth psychology, the primary focus of which is to reveal the unconscious content of a client's psyche in an effort to alleviate psychic tension. This method relies on the interpersonal relationship between client and therapist.
A third treatment method is medication. Medications can include antidepressants or anti-anxiety drugs. Antidepressants are taken every day and they alter neurotransmitter configurations which can help block symptoms. Anti-anxiety drugs are beneficial but run a high risk of addiction.
Next is a video on what to do if someone around you has a panic attack.
Hi, this is Ben Brennan from Austin, Texas. I'm coming to you on behalf of Expert Village, and today we're going to be talking about panic attacks. Let's talk about what you can do to comfort someone during a panic attack. The first thing you should do when someone is having a panic attack is listen. Although the person having a panic attack may not be able to immediately verbalize what they need, if they can tell you are ready to listen to what is going on and how you can help, you won't even need the rest of this list. You can just do whatever your loved one tells you they need. Another thing you can do for a person experiencing a panic attack is letting them know you care. A way to communicate this for most people is just putting an arm around that person or hugging them. This is the way your friend has physical evidence that they are not alone, to combat the physical messages of panic that their body is producing. Obviously, only do this if you are there with that person. What I mean is that this is definitely not the time or place to make an acquaintance or a friend even more anxious with an unwanted hug or inappropriate affection. Finally, show that you are truly supporting them by looking your friend in the eye. Eye contact can go a long way in expressing to the person that you are with them. This does not mean staring at them silently. This may give the appearance that you are shocked or scared. The last thing they need is for their friends around them to panic. Warm, supportive eye contact, along with appropriate touch and affirming words, will give a person experiencing a panic attack what they need, which is to know that you are concerned and that someone that cares is present with them, not just physically, but emotionally as well.